The Telangana Junior Doctors Association, that is T-JUDA, began an indefinite strike on Monday, which has continued today as well. Although several hospital management instructed all senior doctors to cancel their leaves, the elective surgeries had to be postponed due to the strike. Now, the junior doctors comprise frontline medical professionals who work in hospitals across Telangana, such as Osmania General Hospital, Gandhi Medical College and Hospital, and Kakatiya Medical College. On day one of the strike, that is yesterday, the striking doctors met with the state's health minister and also with the DME, Dr. Vani. But seems like the talks happened, but not really, in the sense it was not satisfactory. Meanwhile, on your screens right now, the main list of demands which were made by the junior doctors: creation of a green channel to ensure regular payment of stipends, honorarium for super speciality senior residents, removal of 15% reservation of seats for Andhra students in Telangana, deployment of police personnel to prevent violence against doctors, adequate faculty at medical colleges, construction of new hostels and improvement in hostel facilities, a new building for the Osmania General Hospital. Apparently, the health minister did give them a timeline, gave them a hearing for most demands, but according to the representatives of JUDA, there's been a lack of clarity on several issues, and therefore the strike continues on day two as well. Let's now go across to the representatives of JUDA and talk to them as to what the scenario looks like. Dr. More Vamsi Krishna, who's State Joint Secretary, Telangana JUDA, is with us, and also Dr. Chandrika, who's a spokesperson for the JUDA Telangana, is with us. Let me start with you, Dr. Vamsi Krishna. Tell me something. Why is it that the minister met you yesterday? Am I right? Also, he gave you some assurances that these things will be done. Let's, for instance, start with the stipends. You said that, you have to credit it by the 10th of every month. There have been long delays. They said, yes, we are creating a timeline for it. Why is it then, Dr. Vamsi Krishna, that you have continued the strike on day two, sir?
So, thank you. First of all, we have met our Honorable Health Minister yesterday afternoon, and we had a detailed discussion of our demands. All the demands that we were asking for him were put forward, and he was briefly explained about the technicalities of what are the steps that need to be taken. So, regarding to the first demand, the green channelization of stipends. It's nothing but the stipends should be regularly credited to our accounts. That's the primary demand that we are asking. Green channel is nothing but the primarily the amount which what we are getting is to be credited in our accounts in a particular period of time, at a particular time. So what we have asked is to channelize the funds which are already available, to be credited in a particular time. So he has assured that there is a release
That's
of
what,
budget.
sir, I asked you, doctor. I said that. I'm asking you, then why are you continuing with the strike on day two?
See, the budget has been released from the finance ministry and was kept in the control of DMA ma'am. So, but the guidelines for as of how this amount is credited in what particular basis and what time, the technicalities of it has not been completely formulated. So that is why we are continuing with this. And
All
the
right.
other demands which are there has to be addressed.
All right. Dr. Chandrika, let me bring you in. Now, we are also hearing that, certain things about new hostel facilities, roads in KMC, deployment of security forces, there is no clarity on that. So, Dr. Chandrika, is that why you are continuing the strike on day two as well? Or you think that on every demand, the demands that we played on the screen right now, there's been no clarity, Dr. Chandrika?
So yesterday we met the health minister. We have been the health minister has discussed all the eight issues with us, with which we went on the strike. The first issue regarding the green channelization, another security issue, and also the new OGH building, which is having a glorious legacy of past 100 years. This
Yes.
Osmania General Hospital building should be we have to get a new Usmania Billing Hospital as soon as possible because the health care is being affected. The poor public are suffering with not having a proper health care. Telangana state's legacy is there in Usmania General Hospital. We are requesting the state government to have a word on the Usmania General Hospital. This is our major demand. The second major demand, other than our stipends regularization, is that Usmania General Hospital. We need a confirmation from the health department and the finance department, whole state department, regarding when are they going to start the hospital, when are they going to lay the foundation of the hospital,
Wait,
when are
Dr.
they going to lay.
Chandrika, Dr. Chandrika, let me go to Dr. Vamshi. Dr. Vamshi, I was there when COVID had broken out, and I saw the horrible condition in Osmania. Water had come into the wards. There was water trickling from, because it was raining at that time. Patients, one bed, two patients were sleeping. There was just one IV. They were sharing it. It was horrendous. But the point is, when I asked the then BRS government about it and the health minister, who was, I think, Itala Rajender, if I remember it right, I was told that, look, this is a heritage building. We have to get a lot of clearances. We can't possibly just break it down and make it. Do you think, Dr. Vamshi, that's the main problem in Usmania?
No, as of the present government is committed. It is very much committed to the cause of new building for Usmania Hospital. But there is a certain litigation that we have been told. A court case is pending regarding the demolition, whether the old building has to be demolished
Yeah.
or new building has to be constructed in elsewhere. So until a court gives clearance, the government is not possibly ready to take a
Yeah,
step.
it can't do
And also the
anything,
government
no.
has identified.
Yeah, it
Yes.
can't do anything. You see, their hands are also tied. So I am asking you, with so many surgeries and everything, of course, you will do emergency services. But a lot of people are suffering the way you have suffered. You are doctors, you are under oath. What is the way out? Dr. Vamshi, will you continue like this unless you get something in written?
Yeah, we are committed to the cause of hospital. You see, unless the new building of Usmania Hospital is constructed, people will suffer. Also, the lives of 4,000 doctors who are staying in the hospital or working in the hospital, be it doctors, be it patient, be it fourth class employees, anyone who is staying in that building are at risk.
All right.
Until
Okay, I get
we don't
that
know
point.
when the
So, Dr.
yeah.
Chandrika, are you saying that unless it is rebuilt, you will keep the strike on? I mean, that could take 4 years. What do you do?
It's not about rebuilding. We want an assurance from the government that the where at what place you are going to construct the new hospital, at what time are you going to lay foundation, and how much budget are you going to release, and when is the budget getting released?
All
And
right.
when coming to the heritage building, the
Huh.
main was to treat the patient. It is why we have to see in the scenario like heritage building. The main motto of the building when it was constructed 100 years back, the main motto of the building was to treat the patients. It was for the healthcare. When that building is not used now, then why we are focusing more on the heritage things? Rather focus on the public health. Rather focus on the poor health conditions of the people. Is what I
Okay, that is,
think.
that's a discussion because conservationists will say that we cannot possibly demolish a heritage building. It is part of Hyderabad's history. We can't do it. You are saying, well, go back to what you started this hospital like the Nizam or the King did. That is to kind of have it for public health. I understand your point. But also to understand is that when will the strike, till what time will the strike go on? That is what I'm trying to understand.